This one is about refraction. What conditions need to be met for refraction to happen in ultrasound?
You need two things for refraction to happen. First, the ultrasound beam has to hit a boundary between two materials where the speed of sound is different. And second, the beam has to hit that boundary at an angle, not straight on.
So it's like the sound wave has to be hitting that boundary at a slant for it to change direction.
Exactly. If the beam hits straight on, there's no refraction. But if it hits at an angle, that wave will bend as it goes from one material to the other.
Okay, that makes sense. This one is about pixel density. How does pixel density relate to ultrasound imaging?
Pixel density is just how many pixels you can fit into a certain area on the ultrasound screen. More pixels per inch means a higher resolution image. It's like comparing an old standard definition TV to a fancy high definition one. The HD TV has more pixels, so the picture is much sharper and more detailed.
So higher pixel density means you can see finer details in the image. Makes sense. Okay, this one is about attenuation again. It asks, how much will a 5 megahertz pulse be attenuated after it goes through 4 centimeters of tissue? Can you remind me how we calculate attenuation?
Attenuation is how much the ultrasound beam weakens as it travels through tissue. It's measured in decibels, or dB. To calculate how much attenuation there is, you need to know the attenuation coefficient of the tissue. That tells you how much the beam weakens for each unit of distance it travels.
So different tissues will have different attenuation coefficients?
Right. Denser tissues like bone have higher attenuation coefficients, meaning they weaken the ultrasound beam more quickly. Softer tissues like fat have lower coefficients.
Okay, so to find the total attenuation in this example, we would need to know the attenuation coefficient for that specific tissue, and then multiply that by the distance the beam traveled, which is 4 centimeters.
Exactly. And don't forget that higher frequency waves get attenuated more than lower frequency waves.
So that 5 megahertz pulse is going to be attenuated more than a lower frequency pulse traveling the same distance. That's important to remember. Okay, this one is about shadowing. What does shadowing look like in an ultrasound image, and what causes it?
Shadowing looks like a dark area behind something that blocks a lot of the sound energy, like a bone or a calcification. It happens because those dense structures absorb or reflect most of the sound energy, so very little ultrasound gets through to the tissue behind them.
So it's like the structure is literally casting a shadow, blocking our view of what's behind it.
Exactly. And being able to recognize shadowing is important because it can help you identify certain structures and avoid misinterpreting what you're seeing.
This is like a game of ultrasound clue. We're putting all these pieces together to understand how the images are made and what they mean. Okay, this one asks about something called the fast Fourier transform, or FFT. What is that, and how do we use it in ultrasound?
The fast Fourier transform is a math tool we use to analyze signals and break them down into their component frequencies. It's super important for spectral Doppler, where we look at how much the frequencies shift due to moving blood cells to figure out how fast they're moving.
So the FFT helps us make sense of those Doppler signals and get useful information about blood flow. But do we use it for color Doppler too?
Not really. Color Doppler uses a different set of techniques to give us real-time info about the blood flow speed and direction.
Good to know. This one takes us back to the old days of ultrasound. It asks about devices that were used for making hard copies of M-mode images. What is the M-mode, and what kind of devices did they use back then?
M-mode, or motion mode, is a special type of ultrasound imaging that shows you a one-dimensional view of the echoes over time. It's like a graph that shows how the position of a structure changes.
So like a real-time EKG, but for ultrasound.
Great analogy. In the early days, they would often use things like strip chart recorders to make those hard copies.
What are strip chart recorders? I've never even heard of those.
Strip chart recorders use a moving pen to draw the M-mode signal on a long roll of paper. Kind of like a seismograph recording an earthquake, but instead it's recording the movements of stuff inside the body.
That's pretty clever. So as technology got better, they moved on from those strip chart recorders.
Yep. Things like thermal printers and multi-format cameras became more common for capturing and printing those M-mode images.
It's amazing how far ultrasound tech has come. Okay, true or false? In a transverse wave, the particles move parallel to the direction of the wave. What do you think?
That's false. Remember, in a transverse wave, those particles move perpendicular or at a right angle to the direction the wave is traveling. Think of that rope example. The wave moves along the rope, but the particles in the rope are moving up and down.
Got to keep those wave motions straight. This one asks about a specific way to measure intensity that's only used for pulsed ultrasound. What is it, and why is it important?
That would be SAPA, which stands for Spatial Average Pulse Average Intensity. It's the average intensity delivered to the tissues during each pulse.
So it's like the average intensity over both space and time. Why is that important?
SAPA is really important for safety. By knowing how much intensity, on average, is being delivered to the tissues, we can figure out if there's any risk of bioeffects, like tissue heating.
Makes sense. We want to make sure we're using ultrasound in a safe and responsible way. Okay, wow, we've covered a lot. I'm really starting to see how all these little details of ultrasound physics are woven into every part of the imaging process.
That's what makes it so cool. Once you understand those basic principles, everything else starts to click into place.
But we can't get too lost in the physics. In the end, it's all about using ultrasound to help patients, right?
Absolutely. Ultrasound is an incredibly powerful tool, but it's only as good as the person using it. Knowing the physics behind it helps you use ultrasound more effectively, more safely, and with more confidence.
All right, I'm ready for the home stretch. Let's tackle those last few practice questions and wrap up this deep dive. All right, let's knock out these last few questions and see what other gems we can uncover. This one's about those parallel line artifacts again. Can you remind me what causes those? And are there any ways to, minimize them so they don't mess up the image too much?
Those parallel lines, we call them reverberations, they happen when the ultrasound beam gets trapped between two strong reflectors bouncing back and forth.
Like an echo in a canyon, right? Repeating over and over.
Yeah, exactly. Each bounce creates another echo, and those show up as those evenly spaced lines.
So those sound waves are basically playing ping pong. Are there any ways to stop that ping pong match?
Sometimes you can minimize them just by tilting the transducer a little.
Oh, okay.
Kind of like changing your position to break up that echo pattern. Other times you might switch to a different imaging technique that's less likely to have those artifacts.
Good to know. So sometimes a simple change in how you're scanning can make a big difference. This one is about phased array beam steering. Can you remind me how those phased arrays do their thing?
Phased arrays are pretty clever. They have all these little elements that can be fired with tiny time delays. And by controlling those delays really precisely, you can steer and focus the beam electronically, no moving parts needed.
It's like each element is a tiny little dancer, perfectly in sync to create that sweeping beam. Now this one asks about the operator control that adjusts the grayscale range. Is that the same as gain?
That's a good question. It highlights the difference between tweaking the signal coming in versus tweaking what you see on the screen. The control for adjusting the grayscale range is called compression.
Okay.
It's like the contrast setting on your TV. It changes how those echo strengths get mapped to the shades of gray you see. Gain, on the other hand, is boosting the strength of those echoes before they even get to the display.
So compression is fine-tuning the grayscale, and gain is boosting the signal itself. That makes it much clearer. Okay, back to color Doppler. This one says blue always means venous flow. True or false?
Definitely false. Remember, those colors in color Doppler, they don't tell you if it's a vein or an artery directly. They just show you which way the flow is going compared to the transducer. Blue usually means flow away from the transducer. Red means towards it.
Right. It's not about the type of vessel. It's about the direction of flow relative to that ultrasound beam. Got it. This one asks about the matching layer on a transducer. What is that, and why is it important?
The matching layer is a thin layer of material that sits between the piezoelectric element and the face of the transducer. It's kind of like a translator between two languages. It helps make sure those ultrasound waves can travel from the transducer into the body.
So it's like a bridge helping those sound waves cross over from the transducer to the tissues. Why do we need that?
Well, without the matching layer, a lot of the ultrasound energy would just bounce right back into the transducer. That would make the system really inefficient. The matching layer is there to minimize those reflections, so more of that sound energy gets into the body where we want it.
Okay, that makes a lot of sense. Efficient transmission is key for good images. Now, this one is about those evenly spaced parallel lines again, those reverberation artifacts. Aside from looking for those lines, are there any other clues that can help me spot them?
One thing to look for is reverberations tend to show up more in areas where you have those strong reflectors, like the walls of a cyst or the surface of a surgical clip.
Right.
So if you see those parallel lines in those kinds of places, there's a good chance it's reverberations.
So location could be a clue. Okay, this one asks about the differences between scanners that use electronic steering and those that use mechanical steering. Can you refresh my memory on the key differences there?
Electronically steered scanners like phased arrays, those are the workhorses these days. They use really sophisticated electronics to control the timing of those pulses to all the individual elements in the transducer. So you get very precise and super fast beam steering all without any moving parts. Mechanical steering is, well, it relies on actually moving the transducer elements around to sweep that beam.
So electronically steered scanners are more agile, more flexible, whereas mechanical steering is kind of more limited?
Yeah, exactly. Electronic steering gives you faster frame rates, more options for how you scan, and you can even create those amazing 3D images.
I'm definitely seeing the advantages of electronic steering. Okay, back to resolution. This one says ultrasound equipment usually has better axial resolution than lateral resolution. Why is that?
That difference comes down to the physics of how that ultrasound pulse works. Axial resolution, remember, that's the ability to tell apart objects along the beam path. It mostly depends on the length of the pulse. Shorter pulses give you sharper detail in the axial direction.
Right.
Lateral resolution, that's your side-to-side resolution. That depends more on the width of the beam.
So to improve lateral resolution, you need a narrower beam.
Exactly. And in most ultrasound systems, that pulse length is shorter than the beam width, which is why axial resolution is usually better.
Okay, that makes sense. This one talks about high-frequency ultrasound research, and it mentions a specific material used in those transducers. What is that material and why do they use it?
The material they often use for high-frequency ultrasound research is quartz. Quartz crystals are really good at that piezoelectric effect. They can convert electrical energy to mechanical energy and back again very efficiently.
Interesting.
Plus, they can generate those super short pulses that you need for high-frequency imaging, so researchers can see incredibly fine detail.
So quartz is like the go-to for pushing the boundaries of ultrasound resolution. That's pretty cool. This one's about a device used to measure the intensity profile of an ultrasound beam. What is that device and why is it important?
That device is called a hydrophone. It's essentially a microphone designed to pick up those ultrasound frequencies, kind of like an underwater microphone.
So it's like a microphone for sounds we can't even hear. What do we use it for?
Hydrophones are crucial for safety testing and quality control. With a hydrophone, you can measure the intensity of the beam at different points to make sure it's within safe limits and that the beam is focused the way it should be.
That makes sense. Safety first. Okay, last question. This is a physics brain teaser. It asks, what do you get when you subtract reflected intensity from incident intensity?
The answer is transmitted intensity.
Oh.
So when that ultrasound beam hits a boundary, some of the energy is reflected back and some of it goes through. Transmitted intensity is the part of the beam that keeps on going through that next tissue.
So it's the energy that makes it to the other side.
Exactly. And how much gets transmitted depends on the difference in acoustic impedance between those two tissues.
Wow, this has been an incredible journey. We've explored so much, from the very basics of how sound waves work to all the complexities of transducers and imaging techniques. I feel like I have a whole new understanding of the physics behind ultrasound.
And that understanding is so important. It gives you the knowledge to make smart choices about everything, from picking the right transducer to getting the best images possible. It's the foundation for becoming a truly skilled ultrasound professional.
I couldn't agree more. It's like having that secret key to unlock all the mysteries of those ultrasound images. And on that note, we've reached the end of our deep dive into the world of ultrasound physics. I hope you've enjoyed this exploration as much as we have. Keep those questions coming, stay curious, and never stop learning. Until next time.